Greetings for the Doctor's Day. I am here to discuss the impact of United Community of Doctors in Indian healthcare today. When we join the medical profession, in the initial days, we take Hippocratic oath. Hippocrates was the father of Western medicine, and way back in 460 BC, this oath was administered to the physicians of that time, and this is true even today. The medical professionals even today seek the Hippocratic oath and then follow the ethical guidelines given by the Hippocratic oath. In Indian scenario, it is the Code of Medical Ethics given in Indian Medical Council Professional Conduct, Etiquette and Ethics Regulations 2002, which are used to regulate or ethically guide the medical professionals as such. The Code of Medical Ethics describes duties and responsibilities of the physicians or the medical professionals. These duties and responsibilities are in general towards each other, towards patients, and duties to the public also. The meaning of this under the Code of Medical Ethics is that it is expected that the doctors and the medical professionals in India are supposed to follow the guidelines given in Code of Medical Ethics. Now let us come and discuss to a current scenario. Though the doctors from India, they have been applauded all over the world. They are the ones who definitely have a good name all over the world. But then in India, the scenario has changed. So a doctor, along with the clinical outcome, has also to take care of the legal outcome of the medical treatment. And the meaning is the doctor-patient relationship has now changed. Once upon a time, doctor used to be a god, but now it has changed to a service provider and the consumer. By various ways, the consumer tries to ascertain his right. The patient can definitely approach medical counsel under Consumer Protection Act, various consumer courts, various criminal courts to prove the criminal liability, Human Rights Commission. So these are the legal ways by which, if suppose a patient is aggrieved because of the treatment, approaches the various authorities. Violence in the hospital now is increasing a lot, and not only the doctors but the hospital inhabitants, they are worried about this violence. The various reports in media describing the hospitals or doctors, they are also disturbing to the medical professionals. And there are certain other various authorities to whom the complaints and the litigations can be initiated against the medical professionals. I have specifically described this current scenario because all the medical professionals are well versed with this particular scenario, and every medical organization is discussing the ways out of the changing scenario of today. Let us describe the medico-legal environment. Way back in 1995, when Indian Medical Association versus VP Shanta, in this case, the Consumer Protection Act was applied to the medical profession, the consumer court system was known to the medical professionals, and this is a three-tier system which takes care of the grievances of the consumers. In medical professionals case, it is the patients, aggrieved patients approach this system. So today the medical professional doctor must appreciate the medico-legal environment to facilitate safe, effective and gratifying medical career. Let us discuss something different and which is impact making, another scenario which is a financial scenario. As per the World Health Organization, more than 63 million Indians, they are pushed below the poverty line due to the healthcare expenditure. The reason being less insurance penetration, meaning the medical insurance or the mediclaim is less penetrated, but more than 80% of the healthcare expenditure comes from out of pocket, and that is the exact reason why there is a different kind of relationship which has started between patients and the doctors. So this is happening in spite of there is increased overall expenditure on the healthcare by Government of India. We note that there are a number of medical or advances in the medical field, and so technologically the advancements are there, and in India our doctors are not behind anybody, but they are ahead of most of the doctors from all other countries. Now it is known that in United States the Indian doctors outnumber the other doctors, and so a most influential country also definitely accepts Indian doctors as the best doctors of the world. Let us discuss about the patient safety. Whenever we as doctors treating the patient safety is far more important, and the World Health Organization has always come out with the details of the techniques and the trainings, various programs on the patient safety. What is the meaning of this? Meaning is the patient who is being treated at the hands of a doctor, medical professional, should be safe, and exactly this must be the primary aim and responsibility of the medical professional. The doctors should uphold the patient's right of no harm. So this is a right, patient's right, that patient says that whatever treatment is being given to me, I should not be harmed. Uphold the patient's right of autonomy. What is the meaning of this? Meaning is the patient should be given all the options of the treatment for the treating of that particular disease, and the patient should choose. So choosing from the various options is the right of the patient, which is known as right of autonomy, and this has very much importance in the eyes of law. Obviously, everywhere the documentation is quite important, records are quite important. Considering the current scenario, on one side there is a change in the doctor-patient relationship, and the doctors are considered as service providers, patients as consumers. Whenever something goes wrong, it is the deficiency in the service, it is taken as medical negligence. So this is one scenario. Another scenario is that it is the patient safety which is of a prime importance. This is quite important, and upholding the patient's rights at each time is quite important. Financial crisis is another thing, meaning it's difficult for the patients, as well as in our vast country, it's difficult for our patients to pay for their treatment, and it is the affordability which is quite important. So considering all this scenario, now what needs to be done? The most important thing is all the doctors, medical professionals should unite. The topic, today's topic is the united community of doctors. See, this concept is very nice one. We need to define how this community should be, what this community should aim at, who they should represent, and what should be the ultimate outcome of this. So all the medical associations and the organizations, when come together, form the united community. The force, we can say, with which they can represent themselves to the government definitely will help in developing, designing new healthcare policies, which is very important. Another important aspect of this community is self-regulation. It's always better that rather than anybody else regulating the medical professionals, it is the self-regulation far more important. So every specialty association and organization should come out with, I'm sure there are rules and regulations, but they should be followed. They should be, the members should be bound by this. So self-regulation, caring for patient safety. This is one of the important outcome which is expected out of united community of doctors. So let the patient safety be the only motto. So today being the Doctors' Day, all the medical professionals should decide that this is the only motto, only aim, that we all will look into patient safety. Another outcome can be helping in affordability and easy accessibility of healthcare. We know that the 70% of the Indians, they live in rural areas, and there is a great problem of accessibility. Affordability is a similar challenge. The united community will definitely come out with different solutions so that the accessibility and affordability can both be taken care of, and I'm sure this will be a very useful one. Another important point is risk management. As we always look into financial risks, risk management, medico-legal risk management is quite important. And the ethical compliance, I specifically use this word. Legal compliance we can understand, because whenever there are laws are there, definitely we try to comply with that. But it is something which is ethical compliance, means though the ethics is not legally binding upon us, we the doctors must go for ethical compliance, which can be definitely possible by the united community of the doctors. Going ahead with the risk management, yes, this is quite important. The community of the doctors at large must look into the risk management. Now this time it is medico-legal risk management. How this can be taken care of? It is the improvement in the communication with the patients as well as the doctor-patient relationship. It is always stressed that good doctor-patient relationship will always help in avoiding the problems and the litigations. Informed consent while treatment is another important principle which must be taken care of. The implied consent is the one which is not written in a written form, but then that is only limited to the examination of the patient. So let us understand, try to understand that whenever we wish to do some invasive procedure with the patient, with the invasive treatment, informed consent is necessary. Let us try to understand this principle and implement in our practice. Obviously, documentation, and documentation, which is far more important. The only thing which will definitely save in the court of law is documentation. So, every medical professional and the doctor must have certain norms of documentation, and I am sure the united community will definitely come forward with the standards of documentation which will definitely be implemented by all the doctors. So this is one more aspect. There is one more aspect, that is professional indemnity insurance. So this principle is quite important. Every doctor, every medical professional must have professional indemnity based on the specialty and based on the complexity of the treatment which he gives to the patient. And I am sure that insurance definitely will be a part of risk management. The United Community of Doctors will negotiate with the insurance companies and will definitely help the members to go for a risk-free practice. What it should be? The community of doctors, what it can do? It can impact on health policies, which is very important. So rather than any policy which is beneficial to a particular section, a policy which is definitely helpful and useful to the patients as well as the service providers, that is doctors, which can be discussed with the government and can be implemented. Good relationships with all sections of the society is the one which will definitely help in future in having risk-free practice, medical practice. We have already discussed about the self-regulation. Self-regulation is something which definitely will help in coming times. What will be the outcome? The outcome will be improved healthcare delivery in India. Now the main aim for which we medical professionals exist is to improve the healthcare of all the citizens, all the country fellow men of India. And this is measured, as we all are aware, that there are certain indicators, healthcare indicators, which are compared with the international standards. I'm sure with the achievement as a team, as a group, as a mass organization, which is United Community of Doctors, will definitely achieve the results which are expected not only by the government but by all of us. With this, let me again wish all of you the Happy Doctors Day, and let us all get motivated, march ahead towards the betterment of our country. Thank you.